we go back to our slides and as you remember, we stopped with the third statement, and let's focus on the sentences. Who was the last person to speak? Ramisha, right? Let us listen to John Parvin. So this is sentence 4, please.
Yes, ma'am. As part of foundation program, it is expected or suggested that weakness of each trainees in DOPs should be improved. Suggested.
Suggested. So we, so people organize this program, and they say you may improve your weaknesses, or you may not improve. It's for you to decide. Or is this program just done like to the improvement of the weaknesses of the trainees? If we say suggest, you may do this or not. If we say expect, you should do this, because this is the purpose of the program. So it's better to use
Expected.
expected. Okay. Well, let us listen to Hala Malik now, please.
Preparation for OPS encounter on the part of the trainee needs to be very evident.
Very evident, yes. So they should demonstrate very strong preparation. Well, the next is for Sultan.
Yes, ma'am. This is the one, ma'am.
Number 6. 6.
During a DOPS, a trainee may or must not seek help from anyone else. May seek
help. Exactly, because they are working in a team and they should demonstrate this kind of skill, communication skill. And the last one is for Sinju.
Communication skills considered or ignored during the examination. Communication skills are considered during the examination.
Exactly. Okay. Let us look at the next slide. Here we have some questions about the article. And let us just try to answer them, and let us listen to Danish.
Yes, ma'am.
The first question is for you, please.
What is the purpose of DOPS? As the meaning suggests, directly observed procedure skills. We ensure that the trainees got the skill to consult the patients, and the assessment of practical skills, and it is developed and evaluated by this RCP, that is
Yes, so just the assessment of practical skills. You're right. Okay. Well, the second question, let us listen to Ashwati.
Yes, ma'am. How many times a year will trainees be observed? I think they will observe for 4 to 6 encounters.
Yes, yes. So the article says about this. You're right. And now Taib. Taib.
How long does each procedure last? Each procedure could last up to 20 minutes. That is 15 minutes for the assessment and 5 minutes for the feedback.
Good. Right. Now, please, Labib.
Yes, ma'am. What kind of specialists are accessors? Hello, ma'am.
Yes, yes, we are listening to you. We can
Okay,
hear
ma'am.
you. Mhm. Can you answer this question?
Yes, the specialist includes what nursing staffs, consultants in secondary care settings,
Mhm.
etc.
Right. Mhm. Well, and let us listen to Hepzibah.
What competencies are the trainees assessed in? Competencies means the skills and behaviors that are needed to demonstrate in the skill during the skill time.
Mhm. Well, so the last just paragraphs are about the competences, no? Yes. Here, for example.
Practical procedures.
Ability, yes. So
Yes, ma'am.
competence in performing a particular procedure. Preparation, yes. As for competences, like knowledge of the appropriate just techniques, right? And if they work in a team, so what kind of competence is given here? Communication skill.
Communication skills.
And here.
Management.
Okay. Well, and the last question here is for Ansila.
Yes, ma'am. Which organization created the DOPS? It was developed and evaluated by RCP.
So Royal College of Physicians, right? Okay. Well, and here for the question about criteria, what criteria are mentioned in the last paragraph? Asna, what criteria do you remember? The ability to do what?
A trainee needs to from where appropriate and demonstrate the post-procedure management as well as good communication skills, where we consider same time feelings of the patient.
Any other criteria?
An ability to do practical procedures.
I see. Who can add? Does anyone else do you have anything to add to this criteria?
Ability to perform a particular procedure, the training and technique of procedure, and there need to be clear demonstration of appropriate preparation before the procedure takes place.
Okay.
And knowledge of analgesic and sedation and aseptic technicals.
Okay, good. So I have a question. Have you found this course book online? I mean, have you got the book?
No, ma'am.
No, ma'am.
So I just thought about sending the book to one of you, right?
I checked the emails, but I did not receive any mail from. I was about to ask it today.
Will you send me email one more time, please? Okay.
Yes, ma'am.
Great. Well, and so about criteria. So these are this is the list of criteria from the text. So we were ability to perform procedure, demonstrate understanding of anatomy, knowledge of techniques, ability to demonstrate post-procedure management, trainees' communication skills, which is also very important. Okay, so all these criteria are given in the article. Well, and so one of the tasks that you are going to do after the class will be to answer these questions in written form, just to focus on this article one more time. So the questions here, which are given here on this slide. So the task is already on Moodle site, and you can just read the instructions, and you should complete this task. And if we go on, I would like you to
listening to.
Just a minute. I would like you to look at the pictures, and because we are going to focus on the process of giving instructions, how the instructions are given by doctors to their patients. And the task here to look at the pictures, and then we'll listen to some parts of the conversations between doctors and patients, and we should match each instruction with a picture. So you can see here seven pictures there. The first row, the second row, and we can just say picture one, picture two, like this. Now let us focus on the listening. So we'll listen and you'll tell me first if you hear or not, okay? And then you should tell me what picture is goes with each of these conversations.
Listening to. 1. Can you just bend your...
Do you hear?
Yes, ma'am.
Okay. Let us start at the beginning one more time.
Listening to. 1. Can you just bend your head slightly to the left? Okay.
Which picture is it?
Last question.
The last picture, yes.
Last
Then-
one, yeah.
Yes, you're right. So the next one.
2.
I'd like you to raise your arm above your head for me.
Fourth
Picture, ma'am.
Yes. Mm-hmm. Okay.
3.
Now roll your sleeve above your elbow. Yes, that's fine.
5.
Yes, the first picture in the lower row. Okay. Yes, this is the picture. The next one.
4. Would you just pop up on the couch for me? That's it.
So, would you just pop up on the couch for me? That's it. So, which picture?
First picture.
The first picture, yes. To get on a couch. Mhm. Pop up on a couch. Well,
5.
Could you lean forward a little bit for me? Good, that's it.
picture 3, yes. Lean forward.
6.
If you could just move towards the edge of the couch. Yes, that's it.
Second row,
Seventh one, ma'am.
So which one?
16.
Yes, this one.
Picture.
Mhm. Yes, just move towards the edge of the couch. Mhm. Just a minute. Yes. The next one.
7. Now, I want you to just turn over onto your tummy.
So, which picture is it?
Second picture.
Second one, ma'am.
The second. Well, so we just understand what is happening in each picture. Now, I would like you to listen for the second time just to understand how the doctor just communicates with the patients, what exact phrases the doctor uses in each situation. I want you to make notes, to listen and make notes about each phrase used by the doctor, please. I'm going to switch on the recording just one more time, and you please just write the phrases used by the doctors. Ready?
Yes, ma'am.
Let's go.
Listening to 1. Can you just bend your head slightly to the left? Okay.
2. I'd like you to raise your arm above your head for me.
3. Now, roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it.
5.
Could you lean forward a little bit for me? Good, that's it.
6.
If you could just move towards the edge of the couch. Yes, that's it.
7. Now, I want you to just turn over onto your tummy.
Well, and one more time, just to be sure that we have written everything.
Listening to 1. Can you just bend your head slightly to the left? Okay.
2.
I'd like you to raise your arm above your head for me.
3. Now, roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it.
5.
Could you lean forward a little bit for me? Good, that's it.
6.
If you could just move towards the edge of the couch. Yes, that's it.
7. Now, I want you to just turn over onto your tummy.
Okay. Now let us listen to Sinju about the picture bending the head. What does the doctor say?
Which one, ma'am? Can you say it once more?
What did the doctor say in the first conversation about bending the
The
head?
the doctor said, can you just bend your head slightly to the left?
So he starts with can you, okay? So then there was picture about raising the arm, and let us listen to Danish.
Yes, ma'am. The doctor said, I would like to raise your arm above your head for me.
I would like you to raise your arm, right?
Yes.
Good.
Yes.
So the next picture 3 is about rolling the sleeves, and this is for Ashpati.
Yes, ma'am. Now, can you roll the sleeve above the elbow?
Okay. And then picture about popping up on a couch. This is for Taib. This one.
It's just what to say.
Who can
Just
help us?
carry.
What did the doctor say? What did the doctor say?
Just asked him to. Can you just? Wait. Pop up on the couch, ma'am.
Okay. Did everyone write "can you" or was another phrase used in this case?
Will you?
Would you just pop up on a couch? Yeah. Well, then the fifth picture about bending. No, about leaning forward. So this is for whom? Labib?
Ma'am, could you lean forward a little bit for me?
Exactly. Then the fifth picture, no, the sixth picture is about moving to the edge of the couch. This is for Hepzibah.
If you could move towards the edge of the couch.
Yes, if you could, exactly. And number 7 about so this picture, yes. So let us listen to Ansila.
Now I want you to just turn over your tummy.
Exactly. So you see that this kind of just in these situations, doctors used a lot of just polite formulas. And if we have a look at this slide, so this is about making polite requests to patients. When we were speaking about giving instructions, when one doctor teaches another how to do some kind of procedure, we used very simple imperative mood phrases. But giving instructions to a patient by using the imperative can sound very harsh, very rude if the patient is ill. That is why the doctors soften the imperative forms and use some kind of polite formulas. They are given here on this slide. To soften imperative, we should add "for me, please," like in the example, "undress for me, please." Or we should use "can" or "could" to make the instructions gentler by changing it into a request. We should "could" is slightly gentler than "can." So we should use "can you just" plus infinitive without particle to plus "please." And then we'll have a form. The examples are given here. Can you just bend your head forward for me, please? Or could you just bend your head forward for me, please? So like this. Then we can also use the phrases "if you can" or "could." Could you just plus infinitive plus "please," or infinitive plus "if you can," if you could. Example: if you can just bend your head forward for me, or could you just bend your head forward for me? Or if we use it at the end of the phrase, just bend your head forward for me if you can, or if you could. So, and it is also possible to use "I'd like you to" plus verb. I'd like you to just bend your head forward for me, please. So you see a lot of techniques, and we should keep in mind that we need to use them while talking to a patient. And there are also some phrases, just we can add this phrase to soften the request. Like, "now, okay, that's it, fine, just that's fine, good." So some short phrases. Now, if we have a look at these instructions and at this sentences, we should decide which of these instructions are inappropriate to use with the patient. So let us read them and decide appropriate, inappropriate. Asna, please, the first one, A.
Could you just lie on your left side for me?
Is it appropriate or inappropriate? If the doctor says this to a patient.
Appropriate, ma'am.
Appropriate, of course. Could you? Yes, we don't, please is not used here, but could you just, this is a very good phrase in conversation with the patient. Okay, Shamisha?
Yes, ma'am.
B line.
If you could just pop up your thoughts and
Appropriate, inappropriate?
appropriate, ma'am.
Appropriate. Okay, so Ramisha.
Yes, ma'am. On your left side, please. That is inappropriate.
How can you change this phrase to make it sound more polite?
Yes, ma'am. Could you just lie on your left side for me?
Exactly. Okay. So the next is for John Parvin.
Yes, ma'am. Just bring your legs up to your chest. Yes, I like that. And relax. I'm just going to. It's inappropriate, ma'am.
And how can you improve?
Could you just bring your legs up to your chest?
Well, okay, but I think this phrase is okay because, yes, just bring your leg up. Could you? Yes, it's better, of course. Because the doctor just explains why the patient should do this, what for, the purpose. Okay. Hala Malik.
Yes, ma'am. Can you get towards your chin and curl your neck? It's appropriate, ma'am.
The next is for Sultan.
Yes, ma'am. I had like you to stand up for me if you can. This appropriate, ma'am.
I'd like you. Okay, if you can. And for the next is for Sinju.
Take off your shirt. It's inappropriate, ma'am. Can you take off your shirt for me, please?
Exactly. Okay. Let's move on. And here we have, there are some sentences, and you see that there are gaps in the sentences, and we should complete the gaps with these words and add something else. So the words we need to use in the sentences are make, tilt, hop, keep, stand up, cough, turn. So just maybe we need to focus on the verb tilt, which means bend. So this is the synonym. Now, and you can also see the picture that illustrates the word, the screen. So these kind of screens we can see in hospitals. So this is at the bottom of the slide. This is the hospital screen. Now let us listen to Danish. Danish, you read the first sentence and you decide which word and which phrase to add in the gap, please.
Can dash the screen and undress for me, please. Can you turn the screen and undress for me?
So what about pop?
Can you pop the screen?
We need a preposition. Pop where? So why do we ask this? Why does the doctor ask the person to do this? because the patient needs to undress.
Privacy.
We should cover, yes, the patient. That is why, can you just pop what preposition should be used? Okay, so we'll just put anyway. You were right about this request. Now let us. Now let us listen to Ashwati. The second line.
Yes, ma'am. I need to examine your lower back. So if you stand up, no. So if you will tilt, I think, ma'am. Tilting means bending, right?
Let us imagine that the person is lying on the couch, and so and if you could turn where on your tummy, please, right? For example, tummy. Okay. Well, let us listen to Taib. The fifth sentence.
Yeah, just dash for me, and again that's fine. Just stand up for me, and again that's fine.
Okay, possible. Any other verbs? Any other words possible to use in this sentence?
Yeah, just cuff for me, and again that's fine.
Okay. So the next sentence, the fourth sentence, is for Labib.
Yes, ma'am. I would like to dash. Do you need any help getting up? I would like you to stand up for me.
Good. The next is so number 5 is for Hepzibah.
Could you please tilt your head to left? Yes, that's it.
Yes, this is the phrase, and the 6 is for Ansila.
Can you make tight fist for me, or can you keep make tight fist for me? Fine.
Yes. And the next is for Asna, number 7.
Dash still for me if you can. Okay.
So still. So, for example, if the doctor listens to the lungs,
would you like to?
What does the doctor ask the patient to do?
Would you like to keep still for me if you can?
To keep or okay. So yes, actually,
Listening.
All the phrases are given here, and so yes, so let us just listen for these phrases now.
Listening 3.
Do you hear?
1.
Can you just pop behind the screen and undress for me, please?
2.
I need to examine your lower back, so if you could turn onto your tummy for me, please. Thank you.
3. Just cough for me. And again? That's fine. 4.
I'd like you to stand up for me. Do you need any help getting up?
5.
Could you just tilt your head to the left? Yes, that's it.
6. Can you make a tight fist for me? Fine. 7.
I'd like you to keep nice and still for me if you can. Okay.
Well, in the last phrase, I'd like you to keep nice and still for me. This is like the fixed expression which can be used in requests in the conversation with patients. And this picture illustrates, which sentence does this picture illustrate?
Tight fist.
Six,
Can you
yes.
make a tight fist for me?
Exactly. Well, and
Listening 3.
this is the home assignment. So you remember that one of the assignments will be to answer the questions in written form. You should write them on a sheet of paper, and you should just make the screen or the photo, take a photo of the ready-made homework of the paper and insert it in, put it into PDF file and upload the PDF to the Moodle site. And there is another home assignment here. This is the task to describe the cannulation procedure. You should write a list of instructions you would give to a patient to carry out the whole procedure. Not to your colleague, but to a patient. It means that you should use the polite forms of sentences, and you shouldn't use the very complicated language. You should make it simple. And so you should also write it and do everything like we usually do with the writing task. Upload this to Moodle site. Yes, that is all. Just and